This episode is brought to you by Neurocrine Biosciences. Thank you, Neurocrine, for helping NADF continue to educate, bring about awareness, and save lives. Welcome to All Things Adrenal. Each episode, we'll hear stories from individuals living with adrenal disease, share updates on treatments, research, protocols, interview medical professionals, and explore all things adrenal together. I'm your host, Vanessa O'Rourke, NADF Community Engagement Manager and fellow adrenal warrior. Today, we are joined by Dr. Joshua Stilley. Dr. Stilley is an associate professor of emergency medicine at the University of Missouri. He provides medical direction for several EMS agencies across Missouri, including ambulance services, fire departments, law enforcement agencies, training programs, and regional communication centers. His work focuses on EMS systems development, medical oversight, and provider education. With that, I'm pleased to welcome Dr. Stilley.
Hello, thank you for having me on. I'm really happy to have our conversation today.
We are so excited to have you with us, and I know there's a lot of different things that we can talk about, but I would love to kind of really find out what inspired you to choose emergency medicine as a career, since it is such a challenging and demanding specialty.
There are lots of fun components to emergency medicine that drew me in. A couple of the main ones. One, I like problem solving, so I get to address new patients with an open playbook of what are we going to do to figure out what's going on and how to help them that day. So I enjoy that challenge of identifying the problems that are occurring, and sometimes they're fairly clear or simple, and sometimes they can be really complex. And especially in patients that have complex medical problems, it can take a fair amount of effort and thought process to be able to work through exactly what the issue and what the solutions are on a specific day. I also enjoy the team aspect of emergency medicine. So in a lot of specialties, the physicians are kind of separate from the nurses, but in emergency medicine, we all have to work together, and it's a very collaborative environment, and I enjoy that quite a bit as well.
It sounds like you like puzzles and tackling it as a community, which is something that I know as a patient, I appreciate hearing from a medical professional because that's not always the case.
I hope that in all of the clinical scenarios, you feel welcomed by the whole clinical team.
That's the goal. And that's why we want to hear from you. And from our perspective from NADF, what is the most important message that we should be teaching patients with adrenal insufficiency and their families?
In an emergency, the specialist that sees you, whether that's the EMS team or the emergency care team, they have access to records sometimes and information sometimes, but they are not your doctor. So having some information that you can help to get that care team up to speed quickly is really, really helpful. And that can be an information page. That could be just a good list of medications that you're on. That can be really helpful for me in an emergency setting the first time meeting you to get up to speed a little bit more quickly. I think it's also very helpful that when patients are encountering the emergency care system, understand that it may take us a little bit of time to figure out what's going on. And fortunately, if the more time it takes, the more stable you are as a patient, which is good and bad. We want to be timely and responsive to every patient. From a customer service standpoint, I want every patient to have a good encounter and be treated well. But other times there are emergencies that come in that may be higher priority. So we do have to triage and balance a little bit. There's also a lot of expectations put on our emergency care system, from outpatient clinics sending more patients to the ER, hospitals being full so patients back up into the ER. So there's a lot of things that happen in the ER that are a little bit beyond the control of the emergency doctor and the emergency team in front of you. So sometimes we're dealing with other issues as well to try to continue to care for the number of patients that we have at any given time.
I can't even imagine the amount of things you're trying to juggle as a medical professional. Solving one case at a time seems chaotic, but doing multiple in an emergency scenario is and very overwhelming to me. But NADF has recently come up with a document that's like a doctor quick sheet that your doctor can fill out and sign. Is something like that you think helpful for patients to carry?
That form is really helpful. Instead of trying to dig through the medical record or verify what information is accurate for you, if you come to me with that information, especially that doctor-to-doctor communication, is really helpful for me to know in short order what's the appropriate care for you today, what is in line with your doctor's wishes, and how can I treat you to the standard that you expect. Because your doctor has that relationship with you and has that expertise. I am not an endocrinologist. I have a good knowledge of emergency care in endocrinology, but your regular primary doctor or endocrinologist are going to have that specialty level knowledge that if we can all use that together, we can treat you in a much faster and more effective way together with that information. And it really does help align expectations when your doctor knows and you know, and I know all together what the right thing to do today is.
Well, and I think so many of us patients have binders of our medical history, and that's a lot to go through. And I can share from my last surgery, I had all my paperwork, but the one paper that saved my life was the doctor information, one with my doctor's name and their phone number. I went into crisis after surgery, and they called her, and she immediately told them what to do, and the team followed suit and did everything. But it was really that, like you said, that information doctor to doctor really can be life-saving.
Yeah, and summarized down, one of the hardest things to do in the medical system we have now, there is so much information. So having an appropriate and available summary so I can quickly reference that is very helpful.
I'm glad to hear that you find that as well, because that's something that we were really excited to create that document. So that's something that patients should definitely keep
very
on
much
hand. So here's a question that pops up all the time. People from all across the country are always sharing different experiences. But why does the EMS system vary so much from state to state, even county to county, and even between agencies within the same county?
Yeah, in the U.S. healthcare system, we really value local control and local responsibility, whether that's your local hospital, your local public health, or your local EMS agency. So it echoes what happens in other areas of healthcare, but can be more acutely felt in the emergency care environment, especially for EMS. With different funding models, different staffing and employment mechanisms, whether that's the county employing the ambulance service or a private company or the fire department or even a law enforcement agency or a completely separate entity or the hospital. And I'm medical director for every single one of those types of agencies, even here in Central Missouri. It does provide for a little bit different or a little bit of variance for each patient when they encounter their local system. There are standards that we set for the different types of agencies, whether that's an advanced life-saving agency, ALS with paramedics, or a BLS, basic life service agency with EMTs. But a lot of that is due to funding. How much funding does the EMS system have? And are they able to get staffing at the appropriate levels? Like a lot of other areas throughout the country, EMS does not have enough clinicians to fully staff everybody that we would like at a high level. We continue to work to improve that as a workforce, as a system from the recruitment, the education to the retention. But there are a lot of barriers to do it well, and that makes it difficult. Not an insurmountable problem, but something that may be felt by that patient when EMS arrives and may not be the most experienced paramedic or may be an EMT instead of a paramedic. Just for reference, an EMT is somebody who has good training, but they're not able to start IVs. They're not able to give medications in the same way a paramedic can. And that could be some of the variability that a patient feels acutely when an EMT shows up and is not legally able and not trained to give the medications, the steroid medications in real time like a paramedic can. But even in some states, paramedics cannot administer certain medications and cannot take orders from not their medical director. Fortunately, in Missouri, we have that ability for our paramedics to give steroids and to take medical control orders for patient-provided medications. But again, that's not standard. That's something we're working on and that the EMS community is trying to improve. But it takes advocacy, it takes education, and it takes time.
And we're so grateful for all the work that you have done and the progress that you have made for our community and for EMS training, because you can't I can't find the vocabulary, but there's no level of appreciation. It's saving lives literally. But, and I hate to play the devil's advocate here, but like in the meantime, what do patients do who are living in these counties? Like I spoke to a patient today who's the closest treatable center or EMS protocol is 3 hours away. Like, what do patients do in the meantime? How can they advocate? How can they keep themselves safe?
There's a number of ways that patients can really be their best proponent, along with your friends and family members. Taking that, I don't want to say the responsibility, but taking some of that authority for how you're going to receive care. Having the medication, the emergency medication ready, available, and up to date. Making sure you are able to give it and or family and friends, so trusted caregivers are able to deliver emergency medication. Another thing to advocate for yourself is meet the ambulance service personnel ahead of time. A call ahead, a visit, stopping by, attending training, meeting with the medical director. If it's allowable, making sure that the protocols are in place to provide that patient-specific level of care ahead of the emergency. We spend a lot of time in EMS preparing for emergencies, and preparing for a specific patient in our response area is a fantastic way to spend some of that effort. We can't prepare for everybody for everything, but for high-risk patients with specific indications for care, that is something that in our agency we do and a lot of other agencies do as well. And our EMS clinicians are there to serve the population. They like serving people. They like being involved in the community and responsive to the community. So by and large, making a visit or having some communication with an ambulance service ahead of time, they're going to welcome that and be responsive because it helps them provide better care, more coordinated care, and be a good part of that community.
I completely agree. And I have done that. When we moved into a new complex, the first thing I did was meet the EMS team, talked about everything. They didn't know anything about Addison's. It was a great conversation starter. And I did learn, and this is, again, different for states and counties, that there are certain programs within EMS, and maybe you can speak on this, that they can save or star your information based on your home with your medical information. I didn't qualify because I rent, I don't own in my area. But if you own a property, you were able to tag your medical information to that address. So that's, something that patients could maybe do. Is that something you're familiar with?
We have a couple of different systems that can do that. We have a system called STARS, Special Needs Tracking and Awareness Response System. That is a system that we run for our pediatric patients that have special needs, especially that are going to have different care than our normal and usual patient in the field. So it's a way we can have predefined medical care, predefined orders, and coordination between specialty hospitals, referral hospitals, and our EMS systems. So that's one we have in place that we already use, especially on our high-risk pediatric patients. Some computer-aided dispatch CAD programs. So that's what your 911 centers will use to take your information, put it into the computer, and send resources. A lot of CAD programs can have address alert tags. So if you reach out to the ambulance service or the dispatch center, they may be able to put an alert tag on your address of a special needs patient at that address. Probably variable on the agency, whether that is a rent or a ownership. I don't think that's ever come up for my agency, so that would not be a limitation for us, maybe for others. Not every system uses computer-aided dispatch, so not every 911 center will have that availability. But again, reaching out ahead of time so that there's that communication. They may have other ways that they can help communicate or identify patients early in the system so that ahead of time we are aware of what to do.
I'm a huge fan of preparing for the worst because doing it prior to an adrenal crisis, you're obviously in a better state of mind and more capable. If you're the one personally advocating and having to do it, if it's not a family member, if you're the one doing the research, it's so helpful to do it prior and to make sure that you have everything. I'm obnoxious. Like I have a seatbelt cover, I have a car decal, I have a cover on my phone. Like I am safety everywhere because you can prepare and plan, but still, like, you don't know where you're going to have an adrenal crisis. It might not be in your home. It might not be in your district.
Yeah, I think we have to plan that the most inconvenient time is when an emergency is going to happen. So what is that time? A phrase I like to use is, I may be paranoid, but am I paranoid enough? So have I done the right steps to prepare for an event, a disaster? And in EMS, we spend a lot of time what-ifing, like what if this happens, what if that happens. So I think taking reasonable steps, we don't need to go overboard everywhere, but having reasonable steps, reasonable precautions, reasonable preparations can be really helpful in that time of emergency. And under stress in crisis, that you're doing the best to advocate for yourself is very helpful.
So let's go down that alley then from an EMS perspective. Like, what can patients do to help ensure that they receive the most appropriate care during an adrenal crisis emergency?
Yeah, so the things we've talked about, having your medication with you and available, having trusted friends, family, other caregivers who can give the medication, having a information sheet, especially from your physician or other summary that you can provide to responders, a list of your medications available, which usually is best on that summary sheet. And then what I would say professional. You're a professional patient. You're a professional patient caregiver. That professional interaction with our emergency responders goes a long way. The right level of pressure, the right level of insistence to advocate for yourself. And that can be a tough balance to be an advocate, but not be overbearing, not be over pushy to, push somebody away. So finding that right balance. But again, it is okay to advocate for yourself, and it is okay to be clear what your expectations are, but understand sometimes there may be limitations that don't allow us to do that at the same time.
It's a fine line, and it definitely is about finding that balance and respecting, because it is incredible what EMS and medical professionals do, and we want their help. And, as a patient, I don't want to come across as obnoxious or overbearing, but at the same time, it is my life, so I want to make sure that it is protected and safe.
Very much so, yes. And it's very helpful from a responder standpoint when I show up and I do get, hi, this is my issue. Here are my resources. This is what my doctor wants to have happen. Here's my documentation. That makes it very easy for me to know what the right next steps are. So it takes my stress level down, helps me respond appropriately to it to get that right information, but also with some grace and understanding from the patient and family that there may be a little bit of variance, or, things may not be as timely or as perfect, but that's okay.
Okay, so what about another worst case scenario? What about a situation where I've been in a crisis and I'm not able to articulate. I can't tell you what's going on. Let's say I'm alone. I call 911. What's the best preparation as far as like medical alert necklace, bracelet, key ring? Where should my emergency injection kit be at home? Like, what if you don't have any information and you come in? Where's going to be the best places for you to find it as an EMS?
From the EMS perspective, that can be really hard. Bracelet, something on your body or clearly visible from a wallet or purse is going to be helpful. Keychains we'll usually see as well if those are in our pocket or in your body or on your body. But there's no standard computer system across the country, especially for EMS. So most of my EMS agencies cannot link up and see hospital records. And likewise, I can't see the hospital across the street from me. So there is a lot of discontinuity between our healthcare systems for those patient records. So having that information on your person and readily available and, tucked in a seat, or the seatbelt covers are helpful, in your purse, in your wallet. Usually in an emergency, we're going to look for your ID so we can register you in the appropriately. So near your ID is really helpful in a wallet or billfold for patient information, similar to an alert bracelet. But again, no system is perfect. And the sicker you are, the more focused our clinicians are going to be in the primary survey and that emergent care. And we may not do as good of a job on a full body survey to look and find a band on the wrist. I know when I've been treating emergency patients, they may have something wrong with an arm or a leg, but those are separate issues until I can get the head and the chest in working order, because those are my priorities first. So unfortunately, sometimes we can be a little bit slow to recognize that. Even if you as the patient and the caregivers do everything possible to set yourself up well, healthcare is challenging sometimes because of the communication. And every time I encounter a patient, that's a new stranger, a new person I have to learn about. So yeah, like we talked about, the bracelets, the papers available, so that if you are on your own, worst case scenario, you do have some information available to provide to responders. Even if you're not able to provide it yourself, it's there and available.
And I can share from personal experience too, when I've been nonverbal or unable to really communicate, I've literally pointed at my bracelet and just kept pointing at it to like bring attention to it. And same with my paper. Or when I had a crisis in the hospital, I was hardly cognitive, but the only thing I could say get out with steroids. I just kept saying steroids. I need steroids. And it got the message across, and it was exhausting. But there are things that we can do as a patient when we are even limited.
Wonderful. Yep.
Okay, so obviously this is also a call, it sounds like, that if anyone's interested in getting into medicine, we should encourage them to get into EMS because we need more. Is that what you are saying?
I think EMS is a fantastic component of medicine. One of the great parts about my job, I get to work with EMS clinicians who are lifetime career clinicians, what they want to do is EMS. I get to work with people who are pre-nursing or pre-med as part of their EMS pathway. So they work in EMS for a while, gain some experience, serve their community, and then go on to medical school. And that was my pathway. I was an EMT and then went on to medical school later. And we also have people who do it on the side. They have another full-time job or taking care of a family or loved ones, and on the side do some EMS to serve the community. And those are all great ways to do it. But yeah, there are needs pretty much everywhere for EMS. So it's more rewarding for you as the individual to get involved. It's great training. It's the best first aid training you could imagine. So people who have taken an EMT class or especially a paramedic class are very, very well trained in giving good first aid for any of the life-threatening scenarios that could happen.
And there's always going to be emergencies, even outside of adrenal insufficiency, obviously. But that's something that helps people immediately. And obviously, I'm biased. I want help. I want people to help us, and I want people to want to help us. But it sounds like if that is something that's calling to people to help, this is a good space and place to do it.
And it's a great way to explore medicine. If you have an interest in medicine, it's a great way to get in without a high bar to be able to get in and explore, understand, is this the right thing for you to do? Do you enjoy it? One of the fun parts about EMS, it's very sticky when people will take an exploratory class and then start working to say, I'm going to do this and move on. People get really sticky. It's very addictive. It's a fun community of people. The work is very rewarding. It's hard and challenging, but can be very rewarding. And it's a different dynamic and environment than most people get to experience. I experience people in their home on their worst day. That's a very high calling to be in that position to serve people in our community. So very rewarding to be in that role as well.
Especially, as someone like me who I like checking things off the do list or solving something, you get immediate solving sometimes. In a best case scenario, you'll get answers and you can help someone immediately, which is versus like a long-term doctor care where I have relationships with doctors that I've had for 14 years and we still don't know what's going on. So maybe it's more of an immediate rush.
There are many times where I don't get the final answer, the final outcome, but many times when I do get to make an intervention that makes a true difference in somebody's life, and that is very meaningful.
Well, I'm thankful. I'm very grateful. I know I can speak for many patients who we are very thankful for the EMS who do all that they do and the training that it takes, because that is not a skill or a job that I could handle.
And there's a lot of breadth that our clinicians have to cover, from cardiac arrest to traumatic injuries to airway and asthma, bites and stings, all of the environmental things out there to get us, in addition to the medical things like diabetes and endocrine disorders. So an almost infinite amount of stuff that we get to know and learn and understand on a day-to-day basis.
The more you talk about it, the more I feel like it's like a 1,000-piece puzzle with no picture. You're just like putting pieces together that make no sense, and you're like, do these fit? I don't know. Let's find out.
Yep. Put them together, see what happens, move on.
Yeah.
Yep.
Okay, so I obviously want to honor all your time and energy, but I'd love to ask if there's anything else that you want to share to patients with adrenal insufficiency, caregivers, or anyone who's, just starting out and figuring out how to prepare themselves. Any last minute things or tips that you'd like to share about keeping our patients or our members safe?
As we've talked about before, you as the patient or the caregiver are the expert for you or your family member, loved one. So the more you can be that expert, that resource, the better the care will be. So having the resources prepped and ready, being trained and ready with the medication, that goes a long ways to advocating for yourself. And then, like we talked about, communicating ahead of time with your emergency care system, working alongside and collaborating with your doctor and your 911 center and your EMS agency is super helpful when there is a crisis, that as a team we can all work together, patient, emergency response system, and our specialty clinicians. That goes a long ways. Those are the times when we have the most successful care, and it's seamless. It goes well. there's minimal hiccups and everybody has aligned expectations. And that's really helpful for us.
I think this is like a homework assignment then for all patients and caregivers, is in a good way. Like, get your paper in order, make sure all your medication's up to date, have your medical alert prepared, and communicate with your community. Talk to your EMS, talk to your hospitals or whomever, even the fire department. Talk to everybody in your emergency vicinity to make sure that you have everything in order prior to needing it. And hopefully you won't need it.
Yeah, and that can also bring up some areas where you may identify ahead of time, this is going to be a hiccup, this is going to be a barrier, but you know that going in, and that can also be very helpful.
For example, I have a gate code, and that was something I had to communicate with the EMS. I'm like, do you know how to get into my complex? So we had to figure all that out, but that's something that I'm glad I did prior, so that way in the future. It's preparation. This is, once again, like getting your ducks in a row before an emergency and hoping you don't need it.
Very much so.
Thank you so much from NADF and from all of the patients across the world. I cannot tell you how much we appreciate all that you do. You've done such incredible work. You're doing incredible work, and it's literally saving lives every day. So just thank you so much for all that you do.
Thank you for your time, Vanessa, and I really appreciate the advocacy of NADF for the patient population and with efforts to coordinate with our emergency response system as well.
So glad that we can do it together.
Very much so.
Thanks for being here, Adrenal Warriors. I'm your host, Vanessa O'Rourke, sending you all the spoons, and I hope you have a wonderful day. Thanks for joining in on another episode of All Things Adrenal. This episode is edited and produced by Magdalene Zinke. For more information on the National Adrenal Diseases Foundation, please visit nadf.us. If you're listening on Spotify or Apple Podcasts, please leave us a rating and review to help others find out about all things adrenal. If you have a story you want to share or a question you'd like answered, reach out to NADF support at nadf.us.